When discussing the options of what to do after a tooth has been taken out, or if a tooth that needs to be taken out, is to really go over the benefits of a dental implant while also comparing that to the other options that they might have. Patients know about bridges and because they've been around for a long time and are common. But my job is to really discuss the pros and cons of both and really the benefits of having a tooth instead of having to do a dental bridge that will affect the other teeth and the things nearby. Many patients, when discussing what to do about an empty space or a tooth that's about to be extracted, is to go over the long term effects of what happens with a bridge versus an implant. Bridges have problems like any other crown or dental work can have. A dental implant, although also is susceptible to developing problems, is isolated to the implant and not going to affect the teeth nearby, which we want to keep forever. So the biggest long-term effect is that you are minimizing the chance of there being anything bad happening to the teeth next to an empty space as compared to an implant, which is basically like getting another tooth again. Removing teeth and replacing spaces with implants is one of the most common things that patients see me for. One of the things that I discuss with them is that the downside of not getting an implant or not replacing the space or the future space is what's going to happen to the teeth next to the area and also what's going to happen to the teeth on the other side of the mouth. When we have a new space, maybe a molar that we don't chew with anymore, that often leads to overuse of other teeth. And then we run into other problems related to overusing those other spaces and other teeth. So I tell patients really, sometimes a dental implant is an investment into preventing problems with other areas of the mouth. As an oral and maxillofacial surgeon, I was trained in dentistry, medicine, and surgery. How this impacts me and how I plan implants is that I really have a deep understanding about anatomy and biology. I've had to understand every system in the body as it relates to the patient and how surgery is going to impact them. This can be reapplied to patients' healing potential, but it also has to do with understanding how they're going to heal. Is using a different technique or using a newer technique going to help the patient, and how are they going to heal from that? These are the reasons why that I pursued this career was because I wanted to learn and understand all this so we can really deliver elevated care for our patients. One of the most important things that I do as an oral surgeon and someone who places many implants is to evaluate the bone that the implant is going to go into. Evaluating the bone is evaluating the quality of the bone and the quantity of bone. There are many techniques we can use to augment and improve both of those things. It's my job to really understand the health of the patient as well as the imaging findings and the clinical findings that will then lead to my recommendation about what to do about either of those problems. If you choose to get a dental implant, it starts with a really comprehensive evaluation here at our office that includes really dedicated time to understand what a dental implant is, what the healing phases are like, as well as a long term maintenance of the implant. So, with me, that means having many appointments with me, whether that's before, during, or after the dental implant is done, to really kind of walk you through those steps to make sure that we're all successful. What I'd like dentists and my dental partners to know about my process of placing an implant for a patient is not only all the health history taking and understanding the risk factors related to the surgery, but most importantly is about planning the restoration. I use technology here called dynamic navigation with XGuide that actually asks me to place and digitally plan the crown first. So it always starts from a restorative approach where the surgery and implant then is guided by where the crown is going to go and the patient's bite and their aesthetics. So I think planning about how to go about placing the implant, but that being led by the restoration.